So it's really important for us to help all of you understand what Solve.Care platform really is. We are a healthcare platform on blockchain. That much is clear, and everyone knows that. But what do we really do? Three things. We do benefits administration, we do care coordination, and we do payments in healthcare, both single and multi-party payments. So again, administration of healthcare benefits, coordination of care, and payments in healthcare that are often multi-party, multi-cycle, and long cycle payments. And why do we care about these three things? These three areas, the administrative efficiencies, the clinical care access and care coordination capabilities, and the accuracy and timeliness of payment really are the three core pillars of healthcare anywhere in the world. Whether we are dealing with healthcare in the US or Canada or UK or Australia or in emerging markets, there is always someone who is responsible for ensuring that the patient gets the right care and the provider gets the right payment, and everything happens according to either evidence-based guidelines or defined benefits or managed care. And we essentially address the processes and the workflow that drive appropriate utilization of healthcare, appropriate results of healthcare, and appropriate payments of healthcare. So it is important to mention that we are not a blockchain for medical records. I mentioned, and if you noticed, I've mentioned the three things: benefit administration, care coordination, and payment administration, but not electronic medical records and blockchain. We don't dispute that there are good use cases and many companies working on medical records on blockchain. We welcome them as partners, and they can certainly participate in a chain-to-chain integration. And we certainly would welcome an EHR company or electronic medical record company or a blockchain medical records and blockchain company to work with us. To us, it really doesn't matter. What is important is to understand that we are the administrative platform on which we administer and coordinate benefits, care, and payments. But we're not looking to store clinical data on our chain. If clinical data is needed, it is stored off-chain in the vault. And if somebody does store their data, the medical records on a chain, we can integrate our vault with them as needed. But we are really a healthcare benefit administration, care coordination, and payment platform. And we can work with any medical record on blockchain as and when needed. Now, keep in mind, as an insurance company, as a managed care organization, typically I may not have and do not have access to all the clinical data to begin with. So our use cases typically don't require a direct integration with electronic medical records and or blockchain-based medical record systems. But as they become more prevalent and as there are more successful implementations of decentralized medical records, we will absolutely support that ecosystem as an integration to our ecosystem. There is no issue with that. But we are not going to be an EMR, EHR, medical record on blockchain company. Nor are we a single-purpose healthcare app. There are lots of single-purpose healthcare apps, big and small, beautiful and not so beautiful. The issue is not that we need one more app. The issue is actually there are too many apps, and they're all specialized in single purpose. And as a stakeholder, such as an insurer, I have the option of sponsoring umpteen number of apps to my consumers, to my patients, to my members. And I am going to hope that those apps function properly, they don't do any harm to my patient or to my membership. And there is no way I can possibly aggregate these apps into any kind of a functioning benefit ecosystem. What we do is do the exact opposite. We give you a multi-purpose app called Care Wallet, and we allow our clients to inject the need-specific, want-specific, patient-specific app called Care Card in their wallet. As opposed to saying, download 52 apps and I hope you use them, we are saying everything you need in your interaction with me as an insurance company, everything is in your Care Wallet. And if you leave me as an insurer, you take your Care Wallet with you and all the content with you, and when you come back 3 years later, we can pick up exactly where we let off, and you can still continue to use the other sponsored care networks by the pharmaceutical company, by your employer, by your government, by your community, and I do not prohibit you from doing that. We're looking for longevity. Once you start using the Care Wallet, you keep using the Care Wallet, regardless of who your insurance company is, who your employer is, where you live, and whether you are a single person today and you have a family tomorrow. We see the Care Wallet as a journey that will stay with you through your life journey. So we are a platform, in summary, that does sponsored healthcare and benefit administration with the objective of delivering better healthcare experience and results at lowest possible cost to both individuals and groups. That's what we are. We're a healthcare platform that does the healthcare administration, care coordination, and payments for individuals and groups as sponsored by their benefit administrator.